Good morning. Welcome to the fourth session of COVID-19 Leadership Challenge with the theme Mobilizing Resources for Effective, Targeted, and Expanded Testing and Use of Appropriate Technologies. We have at the moment more than 60 participants logged in the Zoom meeting. Thank you for your time. This session is organized by the United States Agency for International Development, or USAID, through its Strengthening Urban Resilience for Growth with Equity, or the SURGE project. This is done in partnership with PUBLiCUS Asia and the Association of Political Consultants in Asia, or APCA. I am Dina Lihauco. I'm the component 2 lead of the project, and I will serve as your host for today. Let me acknowledge the presence of participants from our partner cities, other LGUs, national government agencies, private, business, and academic groups. Just a few guidelines for us to have an orderly session. Today's session is being recorded, and you may view the video recording in the Facebook page of PUBLiCUS Asia. Copies of the presentations will be sent by request. Just put your email addresses in the chat box, or you can also ask our city program coordinators in your cities for copies of the presentations. For the audience, please turn off your camera and mute your microphone while the speaker is presenting. Please use the chat box to ask questions and state to whom they are addressed to while the discussion is ongoing. We will raise them for you or call you during the open forum. Please wait to be acknowledged by the moderator, then open your microphone and camera. Kindly state your name, your organization, and your question. Please ensure that you are viewing the screen in side-by-side mode to see both the speaker and the presentation. Okay. For today's program, very briefly, after the opening preliminaries, we will have the key messages of the organizers of this event. This will be followed by 8 presentations. We will then proceed with the open forum where our speakers can have an interactive discussion on their practices. You may also ask questions and give your comments during the open forum. We'll close with the synthesis of the discussion. At this point, I would like to call on Mr. Sergio Andal Jr., Chief of Party of the SURGE project, to officially welcome all of you and our guests. Sir Serge.
Good morning. Magandang umaga po sa inyong lahat. I am pleased to welcome all of you to this roundtable session. This is the 4th in a series of discussions on local policies and responses to the challenging environment brought about by the COVID-19 pandemic. So we are here today this morning to talk about the challenges of effective, targeted, and expanded testing. This is a very important topic, and this is something that our local governments have been grappling upon since the start of the crisis. This session is organized jointly by the USAID through the SURGE project, PUBLiCUS Asia, and the Association of Political Consultants in Asia. USAID through SURGE, or the Strengthening Urban Resilience for Growth with Equity, seeks to promote economic growth in partner cities in a way that is resilient, inclusive, and equitable. And currently, we work with the cities of Batangas, Legazpi, Puerto Princesa, Tagbilaran, Iloilo, Cagayan de Oro, Zamboanga, General Santos, and Marawi. And we have representatives from all of these cities joining us today. PUBLiCUS Asia is the first and only SEC-registered political consulting and lobby firm in the Philippines. It was founded by Professor Balutokia, our moderator today, who is CEO on leave because she is currently president of Universidad de Manila in the city of Manila. The Association of Political Consultants in Asia, or APCA, is a network of individuals who seek to promote the professional conduct of political consulting and campaign management in the Philippines and Asia. It is headed by Dr. Joey Leviste. I don't know if Joey is already online, but Doc Joey is a well-known business leader and political leader, also one of the country's experts in political management. And so once more, I thank our partners for making this session a reality. Muli, magandang umaga sa inyong lahat. Maraming salamat po.
Thank you, Sir Serge. May I now call on Mr. Lawrence Hardy II, the Mission Director Director of USAID Philippines, to give the agency's message of support.
Mayor Jerry Trenas, Mayor Lucilo Barrion, Mayor Marcelino Teodoro, Professor Joaquin Gonzalez, Ms. Melu Takia, Dr. Joy Leviste, honorable guests, ladies and gentlemen, magandang hapon sa inyong lahat. Good morning. I am delighted to be here with you all today for this very important forum. In the past 4 months, we have seen the number of COVID cases escalate worldwide. We continue to witness healthcare systems as well as economies overwhelmed with the struggle to combat COVID. There's still a lot we do not know about the virus, thus making our challenge to stop the spread of the disease even more difficult, but also that much more important. But this is exactly where our strength lies. In collaboration, we can make a difference in the fight against COVID. Since last week, as was just mentioned, USAID has organized a series of virtual mayors forums on COVID response. Local chief executives discussed relevant topics such as contact tracing, area-focused response and strategies, as well as tourism recovery. USAID's partner cities and guest cities shared good practices along with experts from various parts of the globe. Today, we have again brought together key leaders in local governance and the academe to share experience and discuss insights and recommendations on scaling up COVID testing. Since the pandemic began, the World Health Organization has emphasized the importance of expanded and easily accessible COVID testing, which is the backbone of the COVID response. As a nation and nations implementing physical distancing measures, enforced lockdowns, canceled schoolroom classes, prohibited mass gatherings, and promoted sanitation and hygiene, health officials, frontliners continue to remind everyone that these measures must be coupled and expanded and targeted testing to reduce the transmission in order to help our healthcare system cope. Without widespread availability of appropriate and validated COVID testing, we could lose the benefits of immediate and responsive interactions and interventions to isolate and treat positive cases. When we know where the infected cases are located and clustered, we can implement appropriate measures to break the chain of transmission. Iloilo and Puerto Princesa, which are partner cities of USAID under the Cities Development Initiative, or CDI as we call it, have initiated testing in their own cities and communities. In Marikina City, the local government has already set up its testing laboratory, which has been accredited by the Department of Health here, and has started conducting free screening for its residents. USAID would like to commend these cities for leading exemplary performance in fighting COVID. We hope that through Learning Forum, more cities will be empowered to introduce evidence-based strategies to scale up the COVID testing. USAID is one with you in these challenging times. The US government COVID funds have supported efforts to augment testing capacity of the Department of Health by upgrading laboratories, providing laboratory supplies, as well as strengthening specimen transport systems, all of which are critical in this fight against COVID. These efforts have contributed to an increase in the country's testing capacity from an initial 200 to approximately 12,000 tests a day. USAID's online learning modules are also boosting the capacity of frontline health workers and support staff in more than 100 hospitals that are across the country with the most up-to-date COVID-19 infection prevention and control information and skills. Each component is vital to the efforts that you're all undertaking. In addition, USAID is enhancing the risk preparedness and crisis communication of the Department of Health to ensure the accurate, COVID-19 information, and strengthen supply chain management systems to ensure consistent supplies of life-saving COVID commodities. These are just a few examples of the support which USAID has given since the outbreak of the disease. There's still a lot more work that needs to be done, but we firmly believe, that our collaboration with you, we can overcome this crisis and we can also win the fight. This is a defining moment for all of us, and our leadership is needed more than ever. We hope that this virtual learning session will help us beyond the level response strategy. When our local governments are equipped with the capacity to expand COVID testing, we can better monitor the progression of the pandemic and understand which measures are working. This way, we are protecting everyone in our communities, especially the health workers who are on the front lines battling this disease. May the session be productive and help us share good practices and lessons in advancing good governance in the COVID pandemic. In all of these endeavors, USAID remains your friend, your partner, and your ally. Again, thank you everyone for your support, and mabuhay tayong lahat.
Thank you very much, Sir Lawrence. Thank you, USAID, for your continued support. We will now move on to the highlight of the session, the presentation of our speakers. We have with us today Dr. Maria Rosario Vergere, Undersecretary of the Department of Health. Yusek Vergere is the current spokesperson of the Department of Health. She serves as the OIC Deputy Director General for Regulatory Operation of the Food and Drug Administration of the Department of Health. Dr. Ernesto Bontuyan Jr., Project Management Specialist, Infectious Disease, USAID Philippines. Dr. Bontuyan has more than 20 years of experience in public health, 10 years in TB program management, the Philippines National Tuberculosis Control Program, and 5 years working with World Vision International in Papua New Guinea. Mayor Jerry Trenas of Iloilo City. Before winning the 2019 midterm election, Mayor Trenas was the representative of the Lone District of Iloilo and the mayor of Iloilo City for 9 years since 2001. He was the chair of the League of Cities of the Philippines. Iloilo City belongs to the top 10 most competitive, highly urbanized cities in the country. It won the Most Business-Friendly Awards in 2019 and the grand winner of the Most Livable Cities Design Challenge in 2014. Mayor Oscar Moreno, Cagayan de Oro City. Mayor Oscar Moreno served as congressman of the 1st District of Misamis Oriental from 2004 to 2013. He was elected governor of Misamis Oriental until 2010. Cagayan de Oro has been named as Emerging City of Tomorrow by UN Habitat. Like Iloilo City, it is one of the top 10 most competitive, highly urbanized cities in the country and was declared grand winner of the Most Livable Cities Challenge in 2014. Mayor Beverly Di Macuja of Batangas City will be represented by Dr. Rosana Carmelita Barrion. Dr. Barrion is the City Health Officer of Batangas City. She served the city for more than 30 years. Batangas City is a gold awardee, Philippine Integrated Disease Surveillance and Response, regional level. It also belongs to the top 10 most competitive component cities in the country. With us is Mayor Marcelino Teodoro of Marikina City. Before becoming the mayor of Marikina City, Mayor Marcy served as the representative of the 1st District of Marikina. Under his leadership, the city received the Seal of Excellence in Governance from the Department of Interior and Local Governments, or DILG, in 2019. Professor Joaquin Gonzalez III from Golden Gate University. Professor J is Mayor George Christopher, Professor of Administration, Golden Gate University in San Francisco, California. Professor J is a former City of San Francisco Immigration Commissioner. In recognition of his outstanding public service, the U.S. Congress awarded him with a special congressional recognition in 2005. Dr. Hong Thi Giang Tran Director, Division of Programs for Disease Control, World Health Organization Regional Office, or WPRO. Dr. Tran is the first Vietnamese woman appointed as Director, Division of Programs for Disease Control at the World Health Organization Regional Office since July 2019. She is also appointed as Acting Regional Emergency Director, Acting Director, Division of Health Emergency, WPRO since February 2020. Dr. Tran was the Director of the Department of International Cooperation under the Ministry of Health of Vietnam. I will now give the floor to our moderator, Ms. Maria Lourdes Tiquia, President, Universidad de Manila. Mama Lu.
Thank you so much, Diana. Good morning to everyone. Magandang umaga sa inyong lahat. The order of presentation will be pursuant to the way Diane called our panelists. So let us start with is Dr. Bontuyan around?
I'm here.
Sir? Are you here?
I'm here.
Yes, please. Let's do the start of our discussion with you leading the presentation. Thank you, Dr. Bontuyan.
Can you see my slides?
Yes, Doc.
So, magandang umaga po sa inyong lahat, sa ating Mission Director, si Mr. Lawrence Hardy, ang ating mga mayors and champions, Mayor Trenas, Mayor Moreno, Dr. Barrion, as well as Mayor Teodoro, sa ating mga professors and consultants, kay Professor Gonzalez, Dr. Hung Tran, and kay Mr. Serge Andal, ang ating Chief of Party. And greetings and good morning to everyone, and thank you for the opportunity to share with you some of our activities related to COVID-19 response to the Office of Health of USAID. Let me quickly give you a picture of what we're doing and the assistance that we provide for the COVID response, closely supporting with the Department of Health and other implementing partners in the Philippines. And this is just a part of the whole humanitarian and development assistance as mentioned by Mr. Lawrence Hardy. And we are working closely again with different partners to ensure that the strategies on the COVID response and actions are implemented in the field, as well as supporting the national level efforts. So our health strategic approach for COVID-19 has always been in line with what the government of the Philippines is closely doing. And this is to ensure that there is increased resilience in our local government preparedness and response capacity, and providing those risk communication and community engagement and mental support efforts through our different implementing partners. We are supporting IP infection prevention and control and waste management in health facilities and communities, as well as direct support to different local LGUs in terms of local response relating to contact tracing and surveillance. Many of our activities are also related to WASH, as well as expanding the testing capacity through our implementing partner, the World Health Organization, including the use and the access to transport systems and transporting the specimens to the designated COVID-19 laboratories. Important of our work is looking at also the health financing as well as supply chain management part of the response, and at the same time ensuring that there is continuity of TB and family planning services that needs to be continued during this time of COVID. So we work closely with 6 implementing partners, and these are the World Health Organization, as I've mentioned, related to laboratory strengthening and preparedness, including the complementation in the procurement of supplies for laboratories and providing technical support for training for health workers and on surveillance. Breakthrough Action through Johns Hopkins University looks into risk and crisis communication for activities targeting health workers as well as the general population. In terms of setting up systems to monitor and PPEs and other outbreak response supplies, we are working closely with our implementing partner known as the Medicines, Technologies, and Pharmaceutical Services Management Sciences for Health, and providing direct support to the Department of Health. Our partner, the IDDS through FHI 360, is also closely working with local counterparts and national counterparts, including our ITM, in use of the specimen transport system and specimen transport media to be delivered to the COVID-19 RT-PCR laboratories. Except we're working with them on wash products and communities procurement and infection prevention and control at the community level. Health International, they are directly supporting local government units, particularly in assisting the community health units with the rapid response as well as case management and prevention. Just to highlight some of those activities for laboratory testing, some of our virus transport media has already arrived in Southern Philippines laboratory, as well as our work with WHO, supporting the assessments of the different labs to increase the laboratory capacity nationwide. We have also trained specimen handlers, especially those who are collecting these specimens and transporting this to the different laboratories, particularly in Mindanao and BARM. And we will be happy to share with you the links for these trainings if you are interested to join. This is particularly on those health workers who are actually collecting the specimen and packaging this specimen, safely packaging this specimen to be transported to the various laboratories. In the 2 weeks that we've been running the transport system for Mindanao, particularly in the BARM areas, we have collected more than 1,000 specimens, transporting this to Southern Philippines Medical Center as well as Cotabato Regional Medical Center. In terms of the supply chain management and procurement support, through the commodity logistics tracking tool that we assist and support the Department of Health, available data is now collected real time through the Data Collect app, as well as the IPC training modules that, again, we will be happy to share with you if your health workers are interested in joining, and many of your health workers have already joined, since we have already trained more than 10,000 frontliners in the 17 regions in the Philippines. These trainings will continue and hopefully will be embedded through the DOH Academy, so that access to this training will be available to any health worker in time of COVID and in other facilities as well. In terms of risk communication, the Healthy Filipinas website by the Department of Health is up and running and is a good source of information, especially since we have a lot of misinformation out there. And this would be a good source for information by the local government units on making sure that the accurate and relevant information is provided to the different local government units. For technical assistance to support COVID response, we also have our Reach Health, which is also supporting the community health units and the rapid response, as I have mentioned. And finally, with UNICEF, training for health workers, training for IPC for health workers in the communities, as well as making sure that the IPC information on COVID is reaching on the ground, so to the birds and people on the ground. We continue to emphasize that during this time of COVID, the essential services that is necessary to continue, such as family planning, TB, and other programs in the Department of Health in the Philippines, needs to continue, and to ensure that we provide the necessary support through innovative approaches in these times of restrictions and in these times of challenges, particularly looking at innovations on how delivery of service such as the Nurses on Wheels in Rizal, where family planning supplies are provided to families, the encouraging and consolidating some of our the goods and medicines, not just for family planning, for other programs we deliver to the different clients, as in other cities such as in Davao as well. So this is essentially a quick gist of what we are doing, and we will send you the links for all these trainings that are available to your health workers and to your primary responders. Magandang umaga po sa inyong lahat.
Dr. Bontuyan, may we call on Mayor Trenas? Mayor Trenas of Iloilo? Sir?
Hello?
Yes, sir. Thank you.
we are ready. First of all, we would like to acknowledge the Chief of Party of USAID Surge, Mr. Sergio Andal Jr., the Mission Director of USAID Philippines, Mr. Lawrence Hardy, the Undersecretary of Health, unavailable, Dr. Ernesto Bontuyan Jr., Project Management Specialist, Infectious Disease, USAID Philippines, my good friend, Mayor Oscar Moreno, the outstanding Mayor of Cagayan de Oro, the Honorable Beverly Rose Di Macuja, Mayor of Batangas City, my colleague in the House of Representatives, Honorable Marcelino Teodoro of Marikina, Dr. Joaquin Gonzalez, and the rest. May I proceed, Malu?
Yes, sir. Go ahead.
Okay. Iloilo City was faced with several challenges, which includes the following: the influx of OFWs, LSIs, including authorized persons, and LGU was given short notice, and sometimes there was poor coordination. There was minimum DILG requirements for all LSIs regarding diagnostic, quarantine, and other necessary documents. And that is the reason where we came up on protocols for LSIs. And recently, we were faced with very poor compliance by LSI to quarantine protocols. There is only one laboratory at the moment in Western Visayas, while I have already encouraged 3 private hospitals to come up with their laboratories, and I am going to inspect one of them later this afternoon. And Iloilo City is in the process of constructing its own laboratory. The only laboratory that services the whole of Western Visayas and Palawan and Romblon is now giving us a turnaround time of 8 to 10 days. And that is not acceptable. We have inadequate ratio of swabbing team for the scheduled activities. And aside from the OFW and LSIs, also have transit passengers coming to Iloilo, going to Palawan and Cebu. Next slide. Our initiatives are the following. As early as February 16, I appointed a COVID-19 focal person, a doctor coming from the City Health Office. I also operationalized the incident command system here in City Hall. And it was operational for 24 hours a day. And the COVID task force was organized and mobilized. Next slide, please. Among our initiatives was to prepare temporary facilities. We were able to get a hospital which was no longer operating, and it has facilities for about 120 positive patients. We use our facilities also for about 100 patients, and in true form of private-public partnership, FINMA UI University allowed us to use some of their rooms, and we have also facilities for about 100 patients. Regular coordination with all the agencies. Even up to now, I continue to meet with them, especially because I now want to open up more economic activities. And I want also to allow the seniors and the minors to start attending religious ceremonies and to attend to their essential needs, like going to the supermarkets, buying their own medicines, and attending to their own needs in the public markets. There is a very important coordination with all the different sectors. It takes time, aside from my voice, because we have to let them understand the real situation. It is only after they have understood the real situation when they truly cooperate and make sure that they follow the protocols. We have 30 executive orders regarding protocol, IATF guidelines, and 2 more will be signed by me today to have a stricter protocol for LSI, because initially I allowed LSIs to go on home quarantine after they arrived here. It has come to my attention that there were about 2 of them who turned positive, but defied their undertaking to go on home quarantine and went around their barangays. One had a manicure, one went on drinking spree, and went on tagay, and another one went playing basketball. So from now on, all LSIs who will be arriving in Iloilo will be swabbed. We will no longer use the rapid test kits that we have. We will use that for mass testing. But all LSIs and OFWs will be swabbed, and all LSIs will be required to go either on home, on facility quarantine, or a hotel of their choice at their own expense. Next slide, please. We have conducted mass testing. We expanded the screening to include individuals exhibiting mild to no symptoms with exposure. We focused on vulnerable sectors. We prioritize people with exposure and symptoms. We mass tested City Hall employees, members of the PNP, members of the BFP, members of the BGMP, members of the AFP, members of the Army Reserve, the Navy Reserve, and we continue to do so even today. Next slide, please. We tested cases, individuals with relevant history or exposure to those who have asymptomatic or asymptomatic patients, all our healthcare workers, all SARI cases, influenza-like individuals. We assisted in testing employees of private companies like the SM group of companies, the Ayala group of companies, contractors by the DPWH to let their workers undergo rapid tests. Next slide, please. Initially, we used parallel tests, having our rapid and RT-PCR test kits. This on returning OFW and LSIs, and the rapid test kits have resulted to negative results, giving the returning LSIs confidence to do all the things that they were not supposed to do. From now on, we are not going to do parallel testing using both the rapid and the RT-PCR test. We are going to use the rapid test only for mass testing, and RT-PCR test to be used for OFW and LSIs. And that is one challenge that we have, considering that our only laboratory here at the moment sends the result between 8 to 10, and that is not acceptable. The mass testing that we have already conducted, it can be shown in the next slide. As of today, as of yesterday rather, is a total of 6,486. We have received results for 5,253. And at the moment, we have yet to receive results for 1,233. Imagine if you have 1,233 LSIs and OFW running around the city and thinking that they are safe. And so we are really pushing for the more laboratories here in Iloilo City and for the whole region. Next slide, please. This shows, again, the mass testing results that we have done, only to show that there are still a lot that we are waiting for the results to come out. And to give you an idea, for local cases, we only have 1 death. We have 17 recoveries and 2 are still admitted. Both are still asymptomatic at the moment. For repatriates, we have OFW, we have 15. 14 have recovered and only 1 is still admitted. For locally stranded individuals, I think most of them came from Cebu. 13 were positive, 1 has recovered, and 12 are still admitted. Experience for mass testing of Iloilo City, it is very important that we have more testing centers, no? And that is the reason why we have requested one of the government hospitals here, the Western Visayas State University Medical Center, to continue the construction of their laboratory. The city is in its initial stage construction, while we our PCR tests, PCR equipments rather, we are still on the construction. We finally decided where to construct our laboratory. Phase for us mayors. I was mayor for 3 terms from 2001 and up to 2010. I was in Congress for 9 years also. And this has never been part of our experience before. And that is why I found it very important to discuss this with my local chief executives on how they were handling the problem in their jurisdictions. Because it is only through the sharing of experiences, actual experiences, that we will be able to learn how to deal with this problem. People who do not undergo this experience will not have the moral ascendancy to lecture to us as to what to do insofar as this problem is concerned. It is only the LCEs themselves who underwent this problem, who will be able to give us glimpses of their experiences as to how to deal with this problem. And I value very much this webinar because we will be able to understand and go through the experiences of our fellow mayors as to how they handle the situation in their respective cities. Thank you very much and pleasant morning to everyone.
Thank you so much, Mayor Trenas. May we have Cagayan de Oro Mayor Oscar Moreno, sir?
Hi, Malu. Good morning. Good morning.
Good morning po.
Good morning. And sa lahat ng ating mga participants of this another very interesting episode sa campaign ng USAID to share experiences and learn from them. No? Let me first greet Mission Director Lawrence Hardy, John Avila, salamat, Serge Andal, and Dr. Bontuyan Jr., and U.S.A. Bergeri, of course, Dr. Gonzalez, Dr. Tran, my good friend, Mayor Jerry Trenas. You look dashing in your suit, and you look good. It's been some time that we have not seen each other. And of course, Mayor Teodoro from Marikina, and Dr. Barrion representing Mayor Di Macuja. And to all the participants, good morning. Now let me go straight and share with you our experiences here in Cagayan de Oro. Let me talk about first the challenges. You know, wow, the virus is unknown even up to this day, no vaccine, no treatment. And I can relate with Mayor Trinas, the difficulty, the trauma that we went through in the beginning. It was like you were in complete darkness. You did not know what was happening. You did not know what to do. You did not know what to expect. And my God, what made our challenges a lot more difficult were, number one, we had no testing capacity here in the city or in the region for that matter. Number two, Cagayan de Oro is the center of the region and the gateway to Mindanao, and also the host of the main COVID referral hospital here in northern Mindanao. And of course, with these difficulties, what I did was I asked the Department of Health Regional Office, Northern Mindanao Medical Center, and our City Health Office to join me in a daily press briefing. And we started March 13 every day without fail, except only Sundays and Good Friday. And yesterday we had our 88th press briefing. And objective really is to inform the people. And it's very important that they know about the entire region, the status of the entire region, the scorecard, and so on. Northern Mindanao Medical Center, because not only is it the COVID referral hospital, it is also the Apex Hospital here in the region. So I thought it was very important that Northern Mindanao Medical Center would join me. And, they've been reporting every day, Malu, in regard to all admissions in their arid. Arid is for that section in the hospital for those with respiratory illnesses, no? Since January 31. So all the patients that went through or that were confined and discharged and so on. So we have a record, all confined, the discharged, and then the recovered, and then even the deaths, no? And it was in this press briefing that, before every press briefing we would conduct, we would meet and share our notes. And not only did we get to know the intricacies of all these problems, but teamwork really had been developed. And up to now, that teamwork really is worth one of the things, one of the great things that happened here in the city. And our city health office also contributed. So we had here the Northern Mindanao Medical Center to handle the treatment, and then the city health office to handle the isolation, the trace, and quarantine, and also the intensified surveillance. Early as April, we have conducted intensified surveillance household to household. Parang kampanya ito sa eleksyon. You go to every household, you shake hands, but this one's more difficult even. The team would go to the household and then check their temperature, check kung merong ARI or ILI symptoms and so on, no? And then, so we have mobilized our city development volunteers. This is the group that handled the PhilHealth cards, no? And a group that is very familiar with the people in their barangays, because they would conduct annually the what they call it, the per family payment rate profiling of PhilHealth, because by doing they would check on the households, the children, and so on and so forth. No? The barangay health workers have also been of great help. The barangay nutrition scholars and the BHERS. So we have here three groups, and what I have done was to call them the Rituyas Army. And every day they would report on what they have done. The number would be at least 1,000. No? And each group would be doing its own surveillance, and then they would then be followed by a team from the city health office. And at the end of the exercise, at the end of the report, they would enumerate those that had been addressed already and those that still need to be addressed. No? And one doctor advised this in one of our discussions early on. And sabi niya, we must go on the offensive. Dahil sabi niya, puro tayo depensa, and I think we need to go on an offensive. And ito yun, intensive surveillance. Pareho rin sa zero prevalence, no? And then pareho din sa testing and so on and so forth, no? And then the next, another thing that really had helped, dahil doon sa absence of testing, imagine, it was only in May, early May, that Northern Mindanao Medical Center was able to use their gene expert. Only one machine. And you know the difference, Malu? Prior to the early part of May, the number of patients in the arid section would even exceed 20 per day, not knowing whether the patient is positive or negative. And being advised on the results of the testing after more than 2 weeks. But with the gene expert facility, upon admission, Northern Mindanao Medical Center would already conduct the test, the swabbing. And ever since, kung negative, doon nila nilalagay sa other sections. I realized in the course of our press briefing that ang NMMC, ang total patients niya would be on the average of 250 a day. Doon sa 250 a day, actually, in the beginning, aabot ng mga 20, 30 yung nasa ERID. Ngayon, as I speak, there is only one COVID positive patient and she is stable. And she had already been tested negative yesterday. So, lagay ko today, she will be discharged. No? So, malaking bagay ito. And what I have done, we bought a total of 4 RT-PCR. The city na. Yung dalawa, nilagay ko sa Department of Health, regional office, and they are now operational, plus 1 extractor. And then the other 2, we will add doon sa Northern Mindanao Medical Center, together with 1 extractor. And then I understand Northern Mindanao Medical Center will also has 2 additional gene experts now. And meron pang 2 RT-PCR. So eventually, NMMC will have a total of 7 machines. 3 gene expert, 4 na RT-PCR. And then Department of Health, Division 10 will have a total of 2 with 1 extractor each. And then on the private side, Polymedic will have already has 1, and Xavier University, Maria Reina, also has 1. We're partnering with both of them. In Xavier, the city gave 500,000 via consumables with the understanding that we can refer patients to them from time to time. So with the testing capacity now, I would tell our people that from total darkness to one where there is brightness all over. And we know what we are doing. We know exactly where we are heading. And because of the information provided by the Department of Health, the information provided by Northern Mindanao Medical Center, and the data gathered by the City Health Office. So dito talaga naniniwala ko, evidence-based and data-based talaga. No? And you cannot go wrong. You know, Malu, early on, I was bashed endlessly. Dahil ginawa ko, I declared a general community quarantine. And ironically, the doctors did not like what I did. And, they're doctors, so they know better. And in fact, at one point, I said, ignorance is also bliss. No? Dahil siyempre, kung naniwala ako sa kanila, talagang in the beginning, sabi ng DOH, lahat ng NMMC and all the secondary and tertiary hospitals, private, should accept COVID patients. And the private hospitals, all of them came to me, frantically telling me na they cannot accept COVID patients. So buti na lang, we were able to convince the DOH to look for a solution. So what we did was, and this agreement was reached here in my office. Northern Mindanao Medical Center agreed to be the main referral hospital, COVID referral hospital in the region. Yung secondary and tertiary hospitals will not be admitting COVID positive, but together with the City Health Office, together with the City Hospital and our maternal care packages, our health centers, we will endeavor to decongest Northern Mindanao from the minor cases. I think this arrangement really has helped a lot, no? In that na-maintain natin ang critical care utilization rate at a level na I can say with some comfort, no? And hindi na overwhelmed ang ating mga hospitals, no? And I think this is one move really, looking back, this is one move that I am very, very grateful with, no? Salamat din sa DOH for because DOH could simply have told the hospitals, the private hospitals, You better accept them. Otherwise, we will close you. They could have done that. Pero buti naman, they listened and we were able to come to that arrangement. But still, sikreto lang natin, Malo, the doctors attacked me because they wanted me to order the lockdown. But I said, that will be very, very dangerous, very, very damaging to the economy, given the location and the role of Cagayan de Oro. So now we're doing well. Ang ano natin is LSI, ROF, talagang next slide please. Ito yung mga ano no, ang isa pang challenge. Buti nga ngayon ang Cebu is in lockdown so wala pang outgoing persons there, no. So meron tayong in a way meron tayong respite between Cagayan de Oro and Cebu para na kami extension of Cebu Malo, no. So talagang ano, even during the general community quarantine, meron pa rin mga vessels that would fly between Cebu and Cagayan de Oro, particularly doon sa cargoes, no? But anyway, ngayon, with all these RT-PCR and gene expert facilities that we have, and we are now bolder, I would say, in doing even going straight to RT-PCR. We have also learned na iba pala ang gene expert, iba ang RT-PCR, no? Ang gene expert is more for emergency cases. Ang RT-PCR is more of volume. Compare ko nga dito para maintindihan ng mga kababayan natin na itong RT-PCR para itong maggagawa ka ng torta. You cannot make a torta just one torta. You have to make a cook volume, no? So hindi pwedeng isa lang, 5 lang, 10. You have to have at least 80, 70 in order that there will be no waste, no? So with this, I am also confident that we can even serve Lanao del Sur and even part of Zamboanga del Norte and even Caraga region. So lessons learned, of course, yung fear, anxiety, apprehensions, ang hirap kalabanin yan. Kaya sinasabi ko nga dito in Bisaya, ayaw kahadlok, kabala ka lang. Sa Tagalog yan, huwag kang matakot. But you are correct to worry. We must worry. Because we don't know where the virus is. We don't know what will happen to us. We don't know what will happen in the future. But do not be afraid. And noong una, pinagtatawanan ako dahil parang paradox yung sinasabi ko, no? But ngayon, I think the people understand. Of course, teamwork is very crucial. Lalo na sa social amelioration and social services programs. Partnerships, of course, very important. National level, salamat sa lahat ng agencies, DOLE, DOH, DTI, maganda ang ating relasyon with all the national agencies. Of course, evidence-based decision-making. And again, there is now a debate whether we should go RDT first or proceed with RT-PCR. And I hope that we will be learning some lessons in this session. Of course, technology is always an ally. So I think this is the last slide. Malu, friends, maraming salamat. And of course, salamat sa USAID for continually supporting Cagayan de Oro and the other cities. Salamat po. Good morning.
Thank you so much, Mayor Moreno. May I call on Mayor Di Macuja, represented by Dr. Barrion? Dr. Barrion, are you ready?
Yes, good morning, Ma'am. Good morning, Mama Lu. Good morning, everyone. Honorable mayors, to our officers and officials and members of USAID Surge, good morning to everyone. On behalf of our Honorable Mayor Beverly Rose Abaya Di Macuja, I would like to thank each and everyone for giving us the opportunity to share our experiences with regard to our expanded testing for COVID-19 cases. So just to give a brief description of what Batangas City is, it is a first-class component city and is classified as a regional growth center in the Calabarzon region. We have 105 barangays, 41 of which are urban and 64 are rural. Out of the 64 barangays, we have 6 in the island called Isla Verde or Verde Island, which is located in the Verde Island Passage, which is considered as the center of marine biodiversity in the world. As of now, we have a population of 349,502. So next slide, please. For the challenges in what we are doing with COVID-19 testing, first and foremost is the inadequate supply of the naso and oropharyngeal swabs. We were not able to get this NPS and OPS swabs on a regular basis because of the limitation that our ITM has during that time. And one thing also that made us temporarily stop our operation with regard to testing is the scaling down of our ITM for 9 days, wherein their health workers were found to be positive or confirmed with COVID-19. So what happened? We were also we also stopped doing the testing of our target clients, and so we were not able to get the results of our specimens brought prior to their scaling down, and it took us around 6 to 10 days before the results were given, because the specimens were sent to other testing facilities which are also catering to other LGUs. We were then referred to a testing facility, but unfortunately, the 4 provinces of Calabarzon could not be accommodated. So we really had to stop during that time. That was around second week of April to the third week of April of this year. Number 3 challenge that we have is in the prohibition in the use of LGU funds for the purchase of the rapid antibody test during its initial circular. Not that we would want to purchase the the rapid antibody test kits, because as of this present moment, we have not used any rapid antibody test. If and when we will be using the rapid antibody test, this will be used for epidemiologic study among our confirmed cases, and if we will be doing surveillance in a community where we think there would be community transmission. And also, as of now, there is a delay in the validation being done by RITM or DOST for the rapid antibody test kits, because as per circular of the Department of Health, only test kits validated by RITM or DOST could be used. So even though we would want to purchase rapid antibody test kits for epidemiologic study, we could not do so at the present time. Next one are the hospitals which are dependent on our medtechs to do the swabbing. We have 5 private hospitals and 1 government hospital. So the private hospitals have been dependent on our medical technologists for the swabbing that we are doing in the city. And very much important is the non-availability of a testing facility, not only in Batangas City, but in the whole province of Batangas. But it was only last June 23, last Tuesday, wherein Batangas Medical Center started their use of the gene expert machines, because they have been given by the Department of Health the license to operate with regard to the use of their gene expert machines. So with this, at least we are seeing some light in terms of sending the testing specimens to Batangas Medical Society, Batangas Medical Center. Unfortunately, they could only accommodate 30 in the meantime, 30 swabs per day from Monday to Wednesday. Again, this is another challenge because we really have to go to RITM to send our specimen. Number 7 is the use of the words mass testing. Why is this a challenge to Batangas City? Because when the words mass testing are being heard by the constituents of Batangas City, all the while they thought that everybody in the population have to be tested for the RT-PCR or the rapid antibody test kits, and therefore this gives us pressure as to those who will be tested, because they do not understand what do you mean by expanded testing, because we have to use the word expanded testing. And as stated by Yusik Vergara in one of our virtual pressers, I have heard that the correct terminology that we have to use is expanded testing, so as not to confuse our constituents, because they are expecting that all of them have to be tested because of the fear that they may have this infection or the disease. Next slide, please. What did the city government of Batangas do with regard to the challenges faced by the city? First, when there was a person who could supply the NPS and OPS, we were able to purchase 3,000 NPS and OPS swabs together with the virtual viral transport media rather. And then what we did was to train the medical technologists of the hospital so as they would be the ones to do the swabbing. And the medical technologists of the city health office will be the ones in charge of doing the testing in the community and in the different barangays. We also hired medical technologists who would be of help to our existing permanent medical technologists. So we have hired 2, and as today we already have 5 in the city. Then because of the non-availability of a testing facility in the province of Batangas, we forged a memorandum of agreement with the Philippine Red Cross, wherein the city government appropriated 5 million pesos, wherein we would be able to send to them 1,500 specimens with this 5 million allocation. And it is very important that we have to have the right information. We have to inform the people so that they will be updated with the different information, the data that the city has, because by providing them the right information, they will be well equipped with what is going on in the city and with what is going on with our COVID-19 pandemic. Then the city government is doing active surveillance. As of now, we have already conducted 2,248 swabs, and we were able to accommodate already our frontliners, those who were at the forefront during the ECQs. And we have also expanded the vulnerable groups, because we had one pregnant patient who was tested positive for COVID-19. After that, even before the issuance of the updated interim guidelines on the expanded testing, we were able to, we started doing testing among our pregnants 2 weeks before the expected date of confinement, so that we could be assured that our pregnant are free of the disease, and also to protect our health workers who would be attending to the deliveries of these patients and even those in the hospital. So what did we learn in this situation? This is a wake-up call for all of us. We have found out that not only the city but the whole Philippines, all of us, I suppose, that we were not ready with what happened during this crisis. We should improve our healthcare delivery system. We should not be complacent. We should not be we should not be complacent just because we do not see cases in our city. We have to expand. We have to look for them. And what the city also did was to modify the testing among our LSIs and our returning workers, because these returning workers underwent rapid antibody tests. There were persons who were tested positive for the IgM. There were those who were tested for the IgG. What we did among the persons who were tested positive for IgG, we did RT-PCR test among the contacts of these persons, and true enough, we were able to get 2 positive confirmed cases among the contacts of the IgG positives. So this is something that we have learned, that we modified for a while the testing capacity of the city so as to identify who could be possibly infected, because majority of our cases are asymptomatics. very minimal are those with symptoms, presented with symptoms. As of yesterday, June 24, we have 72 cases, 72 confirmed cases of COVID-19, 9 of which are current, 58 have already recovered, and 5 have died. So this is, as I've stated earlier, this is a wake-up call for all of us. We have to unite. We have to coordinate and collaborate with the different agencies so as to address the situation. This is not the time to be complacent. This is not the time for any finger pointing as to what should be done, what should not be done. But we have to help each other. We have to say that we can fight. We will win this crisis. It's very important. One of the lessons, and I think this is also for everybody, for all of us, that we always have to include everyone in our prayers so that we have to be safe, because if we health workers will not be protected well, who would be doing this type of activity for our constituents? It is very important that we should collaborate and we should help everyone so that we will win this fight against COVID. So thank you very much to all.
Thank you so much, Dr. Barrion. May we call on Mayor Marcelino Teodoro of Marikina, sir? Mayor Teodoro, are you here?
Yes, Malu, good morning.
Yes. Good morning, sir.
Nice to see you again.
Nice to see you, sir.
Mayor Jerry Trenas, Mayor Byron, Dr. Gonzalez, Dr. Bontuyan, Director Hardy, USAC Berhere. It's a very good opportunity for us here from Marikina to be part of this forum. And we would like at this point to share our experiences here in Marikina. First, the challenges, Malu. Basic challenge really at this point for Marikina is how to improve on our carrying capacity, the carrying capacity of our health system. We have a good testing capacity here in Marikina, having our own molecular diagnostic laboratory. And we're able to test 400 specimens a day. And we're able to do this for our own specimen coming from Marikina, but we're also helping other agencies of the national government to do testing for them. And we do testing for them. Likewise, our adjacent and nearby municipalities and cities, because we realize if our neighbor will not be safe, our city will not be safe likewise. We need to cooperate with one another. There's an interdependence in terms not only of in terms of sharing data in the data analytics, but most importantly in collaboration in what action to take in order not simply to contain, but more importantly how to treat those infected with the virus. So the challenge really is this, how to improve our carrying capacity. We need to have a robust and resilient health system. Second challenge, Malu, that we're having is how to have a genuine dialogue with our people, with the community. Sila yung nakakaalam ng problema eh. We could have all the data, but if we do not know the stories behind the data that we have, then this data will be useless for all of us. The people will determine ultimately the solution to the problem, and we need to have a genuine community engagement. Why did I say this, Malu? We have a very aggressive contact tracing, and we could do aggressive contact tracing through our communities. Alam ng mga tao kung sino yung nakausap nila, sino nakasama, sino nakasalamuha. Kaya we really need to engage the community at this point in order to do the contact tracing. Our assumption really is that the virus is here to stay and it will not go away. So we need to adapt to the new normal. And the new normal is the real challenge, how to adapt and how to determine the protocols. This is where Marikina is today. We're trying to craft or to fathom the direction where we're going into, given the current situation that we have. In Metro Manila, we expect in the coming days that the level of quarantine will be further downgraded. So we need to determine the protocols that we will be adopting in order to ensure that our city will be safe at that point in time. Social distancing measures, improve health protocols in public areas, in public markets, in the workplace. What we're adopting really, Malu, is that we have enhanced targeted testing o yung mass testing na tinatawag. We follow the advice of the WHO to screen, test, and treat. How do we screen? We screen through rapid testing. We target a particular sector. For example, our public market, our public transport, our government workers, those in the front lines. We also do some target testing in the workplace in order to ensure that our workplace will be COVID-free. Quarantine is very effective in order to contain the transmission of the virus, but it's not viable in the long run and to cover a large area. The economics will suffer of that particular community of a particular city. So we need to balance biosafety and economic viability. So the challenge, as I've been emphasizing, is that really how to adapt protocols in the new normal. So ito yung ginagawa namin ngayon dito. May mga social distancing kami. Our present COVID case actually is confirmed cases are 325, but we have 138 active cases. We have 157 recoveries. This is a challenge for our health system to improve on the number of recoveries that we could have in the city. Aside from contact tracing and containment measures, those are two important components that should go hand in hand: containment and treatment. Containment in order to avoid further transmission of the virus, para mas konti na lang yung mahawa. Improve health delivery system so that the recoveries could be further improved. So ito yung ginagawa namin. So in the next slide, what you will see are our efforts in terms of containment and treatment. If you could see in this graph or in this data, we have one of the fastest deceleration rate in Metro Manila. As we speak, we have 11.7 days case doubling time. One of the highest deceleration rate. These are some of the measures that we are instituting now in the city, not only in government structures, but more importantly in the private sector, like in the groceries, in the supermarkets, in the markets, public and private, in our workplace. We not simply encourage, but we mandate all the business establishments opening to have a strict social distancing measures. And we penalize those not following strict social distancing measures by having them fine or pay a fine or closure in establishments who are continuing to violate social distancing measures. Uh, Containment also, part of it is that our expanded contact tracing. We organize or we strengthen our city epidemiological surveillance unit. They are given a space, the communication facilities that they need. We do mapping. Where are the hotspots in the city? Kung nasaan yung concentration ng cases. And we do quarantine or lockdown, not necessarily a whole barangay, but only a street or a compound in order to be able to be viable. We support the need in that particular area that is being locked down rather, and need not to support the whole of barangay or whole of the city if you lock down a large area. Of course, everybody knows that we have our own molecular diagnostic laboratory, and we're grateful to DOH to finally provided us with the accreditation that we need. So as we speak now, we could do 400 specimen tests a day with two polymerized chain reaction machine. We received this specimen and it's been processed. Then within 24 to 48 hours, the result will be out. While the patient is being swabbed, after swabbing, mandatorily, they are being quarantined. We also put up a quarantine facility in Marikina, those for PUIs or PUMs. Before we refer to them as PUIs or PUM, persons under investigation and under monitoring in our hotel. It has 45 rooms, so it can accommodate around 45 persons. But now we put up an additional facility in the said area, around another 50 beds, or rather 15 beds, total of 45 beds for each tent. 15 beds. We have 3 tents. We have 45 beds. In addition to the 45 room capacity of our hotel, so we have 90 beds in our quarantine facility. We also use this for our OFWs, for those who just being swabbed before the result is out. Kung positive ka naman, even if you're asymptomatic, if you're mild and positive with morbidities, we put up additional quarantine facility. This is attached to a DOH level 3 hospital in the city, which is among Rodriguez Medical Center. In totality, it could accommodate up to 45 patients. At present, we have 12 patients admitted in the said hospital. Our other COVID patients are admitted in private hospitals in the Metropolitan Manila area. These are some of the, we have organized swabbing teams from various agencies of the government. We have our own local swabbing team from the City Health Office. We have also from the Philippine National Police. We have an agreement with them to do swabbing so that we could improve our specimen gathering and so that we could cover a larger area. This is our enhanced targeted testing. when Metro Manila was downgraded to modified ECQ, when 50% of the workforce reported for work, we do testing in various workplaces, as seen in the pictures that we have. Even our City Hall employees, police, Europe jail um, personnel. We have tested 19,000, almost 20,000 um, individuals from various sectors. Out of that 20,000, there are 76 reactive, meaning exhibited that they have high antibodies. When subjected to confirmatory testing, only 16 tested positive for COVID. And what's important for us, what we based on our experience, is to put up the regulatory structure. So as you could see in the next slide are the various ordinances and resolutions we have the City Council adopted for purposes of enforcing strict social distancing measures, as well as how to implement effectively health protocols under the new normal. Likewise, uh, 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 likewise, we have also legislated some consumer protection mechanism in order to ensure economic viability at this time of at the time of the pandemic. Malu, thank you very much, Malu.
Thank you very much, Mayor Teodoro. May we have Professor Joaquin Gonzalez? Sir, are you here?
Yes, Malu, I'm here.
Please,
Can you hear me?
you can now take the floor. Thank you.
Okay, can I share my, let me just share my screen. Can you see my screen now, Malu?
Yes, yes, sir.
Thank you so much. And thank you so much to, my USAID. We're very happy that you are helping, our former homeland. This is from all the Filipino Americans, particularly here in the San Francisco Bay Area, where we're about 500, thousand strong. As you know, a lot of our Filipino American here in the United States, particularly here in California, are frontline workers because they are care workers, they are healthcare workers. So we're very proud of their service, to the United States. And of course, they continue to serve the Philippines through their generous remittances to the country. I'm going to talk to you a little bit about my experience or our experience here in the city and county of San Francisco, where I am based and where Golden Gate University is based. Okay, so here is a snapshot of the city and county of San Francisco. We have a population of about 800,000. We're less than 1 million, and that's like Zamboanga City, right? Our area is about 121 square kilometers. That's like Lawag, Ilocos Norte. And how many have we tested here in the city? Well, we've tested about 1/8, equivalent of 1/8 of the population, about 125,859 total tests, so far per today's statistic. The average wait time for our test is between 1 and 4 days. We have private hospitals, HMOs, or health maintenance organizations that can do it in less than a day. So there's really a variation on depending on where you go. Now we have 3,219 cases. That is a little less than Cebu City. Deaths, we have 48, and that's approximately like Parañaque City's current statistic. San Francisco, the city and county of San Francisco, is one of the first cities in the United States, if not the first city to declare a state of emergency. Our mayor, even without any single case in the city, to mobilize and prepare resources for what was coming. We were monitoring Seattle quite closely. And down south of the city, we have Santa Clara County, which became the epicenter here in the Bay Area because of the flow of immigrants and our close relationship with China. We have more than 10 flights a day back and forth. 10 flights a week more back and forth to many cities in mainland China. And so we were monitoring many of the inflow of individuals back and forth here. Now, what do we do in terms of mobilizing resources? We took what's called a total SF ecosystem approach, which is normal to the Bay Area. We are a Silicon Valley. We don't have an authority in the Silicon Valley, and yet we are able to gel and draw on the resources of government and other resources that are around us. In terms of the government, we are very fortunate because we are backed by the 5th largest economy in the world. We are, a city within California. California, before this pandemic, had already prepared very well for anything that was going to hit the state. California, as you know, has a $3.5 trillion budget. And our reserves at that time was around $21 billion. The city in itself also has a hefty rainy day fund. There's nothing like preparing and making sure there's financial resources. We had about $600 million reserved for within the city to meet any disaster that was going, or crisis that was going to hit us. And this is why testing is free for all, in the city and county of San Francisco and all over the state of California. And we began mass testing immediately. First through hospital-based testing, but we went through different modalities of drive-through testing and other forms of outreach to many communities. This testing is of course free even to those who are unauthorized immigrants, or what are being labeled as illegals in the country. There is no, you don't need to present anything, no ID. All you need to have is an email, of course, and a phone number for the test results to be transmitted back to you. We also have a large homeless population. In the city, we have 7,000 homelessness, and these tests are actually free, for them. Testing in the United States is quite expensive. It's about $400 to $500 on the average. So this free testing is really very important. The business sector, as you know, the business sector is the leader here in terms of innovative thinking and innovative financing. So when the pandemic hit, a lot of Silicon Valley companies, incubators and accelerators found it as an opportunity, of course, to give back, but also to make money, on the situation. So, that service and profit balance was what drove them. A lot of companies went into various parts of the testing ecosystem. The Silicon Valley area is the home to many angel investors and venture capitalists, and they channeled a lot of funds, significant funds, definitely into this area. We also have a very vibrant CSO or nonprofit community, and the biggest, the biggest nonprofits are, of course, your Chan Zuckerberg Institute that came in and provided significant Chan Zuckerberg initiative that provided significant funds, particularly from donors in the tech arena. But we also have small nonprofits, including our very own Filipino Senior Resource Center, that in their own little way here in San Francisco, they're also able to reach out, particularly to the seniors. What should the world expect? We are the epicenter of innovation and disruptive thinking, particularly in testing. So what are you going to see from our biotech and incubators, from our health tech? The first thing is the accuracy of testing. It is not up to a high level, right now. There are many companies out there, so that the testing quality, it varies. And a lot of Silicon Valley companies and angel investors are investing a lot into this accuracy of testing. The other one that they're going into is what are called self-testing kits. So there are a lot of companies now in the Valley that are already starting mailing out what are called self-test kits. So people are able to do their kits at the convenience of their own home. They don't have to drive to a testing center. So a lot of these self-test kits are coming out. The collection procedure of the viral RNA is also being sharpened and improved, especially the highly invasive nasal and mouth swab approach. So there's a lot of research and a lot of testing, a lot of experimentation going on to alternatives to this. One big alternative that's coming out is use, of course, of spit or saliva. The sputum is collected, and this is now being analyzed, a less invasive approach. And there's, of course, as you know, the viral RNA, as we have found out, doesn't just live in the upper respiratory portion of the body. It goes down to the intestine. This is where stool tests also have come in. Improvements in container and reagents, those tubes, especially if they need to be transported. The chemical reagents that's used to make sure that the viral RNA is more pronounced, and testing accuracy is increased. These are all coming up soon. It's just that it's being disrupted because a lot of the supplies are coming from China, and that's where our supplies chain originates from. Testing labs, I love hearing, of course, our cities in the Philippines are, going into testing labs and big on testing labs, because that's also where we are headed here. Testing labs are important. The closer it is to you, the less time it takes to get the results, and more interventions and management comes in. Antibody testing is also big. This has lagged behind in terms of research and improvement, and it's being refined right now. One appropriate technology here is, of course, we're not big on digital tracking, similar to what's being used in Korea or in China or in other parts of the world. Americans are very conscious about tracking, so that's this is very big to us. I like that some of the mayors underscored the importance of low tech, because even though we are in Silicon Valley, we believe in common sense, and we believe that one big aspect that's being left behind as we go to high tech and high tech testing are the basics, and I'd like to underscore them here in closing. Right, washing your hands and proper hygiene definitely still needed. Social distancing, which we continue to underscore. Wearing masks, and Americans have had to adjust to this. They're not. I like that the mayor of Marikina mentioned comorbidities. because in the United States, as we know, we have big issues with obesity, with heart disease, with cancer, and these are the ones that are complicating and increasing the number of deaths. Contact tracing quarantine. Thank you, and maraming salamat po sa inyong lahat.
Thank you, Professor Gonzalez. May we now have our friend from Vietnam, Dr. Wang Thi Giang Tran. Ma'am? Dr. Tran?
I'm here. Thank you.
Thank you.
Madam Chair. And good morning, Honorable Mayor, colleagues, and friends. Thank you very much for inviting me to present and share Vietnam experience at this very important forum. And also, I'm very happy to listen to the presentation and sharing from our Honorable Mayor on the work I've done. And thank you so much for your great commitment and your leadership for COVID-19 response in the Philippines. I am the director of the Division of Program for Disease Control at the WHO Western Pacific region here in Manila, the Philippines. And at the same time, I'm also acting regional emergency director, and I involved in the COVID-19 response since from the beginning of the pandemic. And today, I would like to share with you the experience from Vietnam, the member state of WHO, and the country that where I'm from. And for your information, as of today, the total number of confirmed cases in the world now reach more than 9 million people worldwide, and the total number of deaths is nearly reaching 500,000 people. And the pandemic is spreading now very still overwhelming in South Latin America, including Brazil, and in our region we have Indonesia becoming the country with the biggest number of confirmed cases in ASEAN countries. And now back to my presentation. Today I would like to share with you the experience from Vietnam. Currently, as of 24th of June 2020, the total number of confirmed cases in Vietnam is 349 confirmed cases, and most of them already recovered, and no deaths reported so far. There was one very critical patient. It is a patient from U.K., but he already recovered, so no death so far. And the total number of tests have been conducted is 370,000, more than 370,000 tests already conducted, and the positive rate is only 0.09%. The still we have a contact under the follow-up, because we still receiving people, Vietnamese people coming from overseas. Most of them are students studying in outbreak in pandemic areas, and they are returning home. And it is so we only have a reported case, but no community transmission for 70 days so far. So as you can see here, it is an epidemiological curve of COVID-19 confirmed case. And we can see there are two waves of COVID-19 in Vietnam. The first wave started very early on 23rd of January. The imported case from China, and then after that, the second wave is starting when the foreigners entering Vietnam from Europe. Next slide, please. Can you move to next slide, please? Yes. So in this slide, you can see the key event and response measure done by the government of Vietnam. So since the country heard about the unknown cause pneumonia in China, the first risk assessment has been conducted very early on the 3rd of January. And after that, the first National Steering Committee meeting has been convinced on the 15th of January 2020. And on 23rd of January, the first case reported, and we already started the national response plan right after that. And then on 29th January, the government decided the entry of all travelers coming from China has been denied. All flight from China and border crossing are all suspended. So very quick response from the government of Vietnam to protect the population by suspending on flight and borders area with China. The second wave just started from EU and from Europe, and also the government also decided to revoke on the visa exemption from country in Europe. And the health declaration applied to all people entering Vietnam. And the government also applied 14 days centralized quarantine for all overseas returner and visitor coming to Vietnam. So it is quite extensive and tough decision made by the government of Vietnam. Next slide, please. Next one, please. So what made Vietnam become the first country in the world who have no cases for more than 70 days as of today? The first lesson learned is that the strong government leadership and the Prime Minister of Vietnam, who lead the whole of society and whole of the government approach against the disease. And his well-known statement is combat the disease as a combat the enemy, become very famous and popular among the countries. And the country also established the high-level multi-sectoral National Steering Committee chaired by Deputy Prime Minister. And the government response plan is still very early, as I mentioned earlier, on the 20th of January, and using a stage-based approach with preparation for community transmission. And with the special and especially with the principle on protecting people's health as the first priority. Next slide, please. Can you move to next slide? Thank you. And the second lesson learned is the strong surveillance and public health system for communicable disease, so that we can early detection and timely action. So it is a very close monitoring of situation and risk assessment from the very beginning of the pandemic, where many countries still do not was not ready for the response to the outbreak, but the country Vietnam already started ready, and the country also have a lot of experience in the past during the SARS outbreak in 2003. After that, influenza H5N1 and H1N1, the country have a emergency operating center already very vigilant on ready to respond to any public health emergency. And the second one is to strengthen the surveillance at point of entries, and then all the early detection and quarantine of imported case to avoid spreading to the community. And the health system has been doing very well on case investigation, isolation and quarantine with foreign quarantine operation, which become very popular now. The implementation of laboratory testing strategy also play a very important role. So the country prioritized the testing, the reduction of untargeted sampling, and enhanced laboratory-based surveillance. Next one, please. Next slide, please. The third lesson learned is for contact tracing. The country have a very active contact tracing system for using the whole of society approach, including the health authority, the other sectors, including military and also the police and other other agency to participate in contact tracing. And the role of local authority is so important. So I am very happy to hear experience from Honorable Mayor today, sharing experience on contact tracing. Next one, please. So it is a following a quarantine system in Vietnam. The first one is the first ring is quarantine and treatment at healthcare facility for cases and they close contact we call F0 and F1. The second ring of quarantine is the centralized quarantine for close contact of case we call F1 and household member or close contact of F1 we call F2. The third ring of quarantine, the home quarantine or self-quarantine for context of those being quarantined in ring 2, we call F3, and quarantine of whole community when multiple cases was reported. We also apply the fourth ring is a quarantine of whole community when multiple cases are reported. Thank you. Next slide, please. So we from Vietnam experience, we see that quarantine have a big impact on reduction of transmission. So any imported case from overseas has been quarantined in central quarantine facility and from at the beginning, and then it stops spreading in the community. So even though now we are receiving more and more Vietnamese coming from overseas, but we apply a very good quarantine system using this whole of government approach, so that this become very efficient and effective. Next one, please. So again, it's a whole of society approach. The role of local authority are so important. The local authority organize a local rapid response team, and in collaboration with relevant ministry, stakeholder, military, information, communication, airline company, travel agencies, community. So the whole of society approach for community for contact tracing. So it is a very good way for tracing the contact, and the hotline has been established to receive any information about the cases and the suspected cases. Next slide, please. The fourth lesson learned is about communication. So the country is doing very well to strengthen communication, to provide information to people, to avoid panic and to take proper preventive measures, especially for personal protective measures, including mask using, hands washing, and isolation when needed, and also media engagement and collaboration with various organizations and sectors to develop risk communication, messaging, and developing the tool and products, and especially have multi-sectoral collaboration for community engagement. So the whole community engaged in the COVID-19 response. So it is some picture of and a lockdown community in hospital has been applied in Vietnam. So the lockdown of the whole communes and of one hospital in Hanoi has been applied when it's necessary, and the duration of the lockdown is from 14 days to 20 days. And they have the daily check-up by the community team and local health staff for those who have been in lockdown in community, and the local authority provide daily food and necessary items for people in the lockdown area. Next slide, please. And social distancing, we also closed school since Tet holiday, our traditional Lunar New Year, and after that we suspension of mass gathering from January to March, and also the government encouraged people to wear face masks in public, and using personal and applying personal physical distancing. Next slide, please. And after that, from 28 March, another directive from the government for cancellation of all meeting and event with more than 20 people, and suspension of religious events and other events with more than 20 people. All cultural and sport activity has been suspended, and the limitation of people travel and limitation on public transport and the flight between Hanoi and Ho Chi Minh City and other provinces in Vietnam. Next slide, please. So since the 1st of April, the whole of social distancing, the government also applied the stay at home for 2 weeks in the country. Next slide, please. After 15th of April, so the country classified the risk by risk assessment. Among 63 provinces in the country, well, we classify that as low risk province, medium risk province, and high risk province, and we apply different social distancing for different level of risk assessment. So Vietnam also apply various approaches, including digital mean to be deployed, including the application, the app for contact tracing and for delivering the message, and the local authority and community engagement are key to the success of the COVID-19 response in Vietnam. Next one, please. So even though the country are free from COVID and no community transmission, but the country is still in a vigilance phase and not complacent to the success because the situation outside Vietnam is still very challenging, and still many people coming from overseas. So the country still keep high alert on the COVID-19 response, and continue to enhance the COVID-19 multi-source surveillance by existing surveillance platform, ILA and SARI Sentinel surveillance, and test and trace and treat, including the early case detection and investigation, active contact tracing, strict isolation and quarantine, and proper treatment. That's why until now the total number of cases are very limited and there is no death so far. We also continue to prepare, ready to prepare for large-scale community transmission by enhanced surveillance and prepare for surge capacity in the healthcare facility and healthcare services, and implementation of laboratory testing strategy by prioritizing the testing and enhanced laboratory testing based surveillance and surge capacity and protect of healthcare facility and protect healthcare worker. And in this outbreak in Vietnam, so far only 4 health staff has been infected, and all of them now recover. And I know that in the Philippines, the number of healthcare workers infected is quite high. So it is that should be the priority for the country to focus on. And also the capacity building on risk communication at all level, and to counter with the rumors and misinformation, and enhance social listening and feedback mechanism. Next slide, please. So I would like to end my presentation by once again citing the statement from the Prime Minister of Vietnam that combat the disease is a combated enemy, and the country accept the economic loss to protect people's life and health, and the priority of the government is to protect life and health of the people, and the safety must also include the peace in mind. And thanks to the strong commitment of the government and the whole of society approach, now Vietnam come back to now for 70 days the country 70 days the country come back to normal, and the economic development return to the normal. So it is a lesson learned from Vietnam. I hope that it would be would be helpful to the Philippines and other country, that the lesson learned from Vietnam would help you in the response to COVID-19 in the coming time. Thank you very much for your attention.
Thank you very much, Dr. Tran. May we have now Undersecretary Beguere of the Department of Health, ma'am?
Yes, good morning, everybody. Good morning, Malu. Good morning to the organizers, USAID, Dr. Gonzalez, Dr. Tran, our local officials, local chief executives, Mayor Trenas, Mayor Moreno, Mayor Teodoro, and Mayor Di Macuja. Magandang umaga po sa inyong lahat. We will be providing you with a brief overview of what the Department of Health and, of course, the government is currently doing for our testing strategies. Next slide, please. So just to give you the strategic directions of the government when it comes to our response to COVID-19. The National Action Plan includes strategies of detecting, isolating, and treating COVID-19 patients. We have guiding principles for us to be able to employ or implement the new normal. So first, we have a whole of government, whole of system, and whole of society approach, which we use in our fight against COVID-19. So right now, if you will observe our response mainly includes our partnerships with the local government units, with our private sector, and the other organizations as part of this whole approach or whole of government and system and society approach to fight COVID-19. The second would be the science shall inform decision making at the institutional and at the individual level. So again, if you will observe, all of our decisions, all of our protocols are all based on evidence, are all based on science, considering the fact and the nature of this virus that we are learning every day because it is evolving and there are a lot of decisions that has to be made day per day based on science that are forthcoming. The third would be we recognize we have limited resources. So our response is really guided by fair and transparent priority setting. So if you again would observe, our priority setting has focused on the vulnerable and those high-risk individuals. And the fourth, in the event of any conflict of rules or guidelines, human dignity and the safety and needs of our individuals shall always prevail. So next slide, please. So the strategic directions is based on these three major principles. First, the national government enables the environment so that the local government can lead the implementation. And we are focused on a people-centered COVID-19 response. Next slide, please. So this slide would just give us a refresher on what the national government and the local government units mandate as to health. So the national government, based on existing laws and policies, we develop the national plans, policies, and strategies. We provide standards for safety and efficacy. We also build capacity and we monitor for progress and evaluate effectiveness of interventions. So that is what we are currently doing. And as opposed to the mandate of the local government units, which are the stewards of the local health system and the primary responders to public health emergencies. And that is what we are seeing right now. Next slide, please. So this slide would just give some form of clarification on the different structures in the national government as well as in the local government when it comes to the response for COVID. In the national government, there is this interagency task force, which is the policy and strategy making, or they provide policy directions when it comes to the response for COVID-19. So the interagency task force is composed of different national government agencies, all in supporting one objective of providing strategies, guidelines, standards, and doing monitoring for the response of government to COVID-19. We also have the National Task Force with its different task groups under the Interagency Task Force, which is responsible for enforcement of all of these strategies, rolling out the plans, mobilizing resources, and doing monitoring for the specific operations that we are implementing. And of course, we have the local government units, which is very important because they are leading the implementation for service delivery. Next slide. This slide would show you the different strategies that the department, together with other national government agencies, and of course the partners in the private sector, the local governments, and the other institutions are doing. Just to emphasize that we have a goal of reducing COVID-19 related and non-COVID deaths. So we would just like to emphasize that we have two pathways in our delivery of services, that having one is having the COVID related and the other one the non-COVID related essential services, realizing the fact that it is not just COVID that we are dealing with right now, but also the other diseases as well. So we have three strategies under the prevention of cases, and we have two strategies under managing contacts, and of course ensuring that there would be no financial hardships in this battle against COVID-19, specifically for our citizens. So under prevention of cases, we have three major strategies. First is increasing resilience. We would like to decrease the vulnerabilities of each individual, the households, and the community by promoting healthy lifestyle, by preventing the different diseases that might occur in a family or an individual. And of course, you'd like to manage the stress through our mental health programs within each families or households and the community. So by increasing resilience, we are ensuring that we may be able to cut off the transmission because people are more healthy and therefore they cannot become sick immediately. The second would be stopping transmission, and with this strategy, we have the different preventive measures for an individual and the community, like wearing mask all the time when you go out of your houses, practicing frequent hand washing, restrictions in travel as well is part of the stopping transmission. The third is reducing contact rate, and this is where physical distancing comes in. Also, we have protocols for the minimum public health standards that are supposed to be implemented in the different settings like workplaces, in schools, if it is going to be opened already, in other public places. So we have the engineering controls and the administrative policies. The fourth is shortening duration of infectiousness. This is where the National Plan of Action is embedded, and we would like to emphasize that it is not just testing, which is important for our means to address the curbing of transmission of this disease. We also would like to emphasize that tracing contacts and detecting, testing, and also isolating would be part of this whole gamut of all of these strategies that we are now employing so that we can better prevent transmission of this disease. We also are emphasizing the use of telemedicine to reduce or minimize face-to-face contact among or between providers and our patients. So the fifth strategy would be enhancing quality, consistency, and affordability of care provision. So the first under this strategy would be managing according to different or two protocols that we have issued as part of our policies. First, we always update our protocols based on our experts and different societies' protocols that we adopt. The second is securing medicines and supplies. We are now part of the ongoing WHO Solidarity Trial for medicines, and also we have already submitted our intent to participate as well in the WHO Solidarity Trial for vaccines. We also, aside from this Solidarity Trial for medicines and vaccines, we also have specific or separate agreements with other countries for medicines. For example, we have this Avigan trial that is set to start where we have the support of the government of Japan. Also for these vaccines, we already are now negotiating with 4 separate manufacturers of vaccines so that we can also participate in the trials that will be forthcoming. We also would like to emphasize on the patient referral network that we have already instituted, and this would mean that in every locality, we are expecting that the healthcare provider network are being implemented so that we can facilitate the referral and eventually the admission of our patients to quarantine facilities or in hospitals. We have ensured availability and safety of sufficient PPEs for our healthcare workers, and also providing them with different forms of training and ensuring that infection prevention and control measures are in place in the various health facilities that we have in the country. The third is the benefit packages from PhilHealth. So we now have this PhilHealth benefit package for hospital admissions due to COVID. Also, we have a benefit package for testing as well as for quarantine measures. We also have instituted a freeze, the price freeze of all of these selected health products, especially which are important for the COVID-19 response. And the last one would be very important is that we have retained the non-COVID pathway in our services that are being offered in the different facilities of the country. Next slide, please. So just to show you an example of our daily case bulletin, which we issue every day at 4 p.m., which provides our citizens or the general public with the information of how much the number of cases confirmed are already in the country. We also have this classification according to fresh cases and late cases, which we are reporting. This is based on the release of the laboratory results, wherein fresh cases would be those confirmed individuals wherein their laboratory results were released 3 days from the time that it has been reported. And for those late cases, these confirmed cases where laboratory results were released more than 4 days after it has been reported. Also, we have the number of recoveries and the number of deaths where the additionalities per day is also included. Next slide, please. We have a breakdown also of active cases. This is very important for the general public to be informed with, because with this breakdown of active cases, we can show them that for severe and critical cases, it is just less than 1% of the entire active cases numbers. So we have about 96% of those being tagged as confirmed to have mild symptoms, and about 3.2% having asymptomatic or no symptoms at all. Next, please. So this is just the national epidemic curve, and this is adjusted for date reporting already, where we have already identified and have tagged the onset of illness or the swabbing date of each individual. And as we can see through this epidemic curve, that the cases, yes, are increasing, but it is not to that point where the health system capacity is already overwhelmed. And also, if you will see, there is this downward trend towards the end of this graph. But again, we always like to remind the public that we should not be complacent and we should always be vigilant. Next slide, please. Also, this epidemic curve would show us that around the country, for the big regions that we have Luzon, Visayas, and Mindanao, where the national picture is the blue line. And we would see that the number of cases are increasing, but there again, there is this decreasing trend towards the end of this graph. We also have the National Capital Region for this yellow line, where we see that cases are decreasing. We have the green line for the Visayas region, where currently we are seeing an increase in the number of cases. And for Mindanao, it has been stable since the start of this response for our situation. Next slide, please. This next one would show us the daily positivity rate, where we are seeing that the positivity rate is already decreasing as we increase our capacity for testing. So for this testing, it is the blue line, where we see that we have increased tremendously in our capacity for testing. And we see that as we increase our testing capacity, the positivity rate is also is decreasing. Next slide, please. So the time varying reproduction number, or the R naught, as we see here in our graph, would show that we have now about 1.2 for R naught in our country, meaning for every one confirmed case, the possibility or the probability of infecting another person is just one person being infected by another person. When we started off with this pandemic, we had about 2 for R naught, or more than 2, meaning one confirmed case can infect about 2 persons in a given time. But right now, we have decreased it to 1.2, and of course, our goal is to have it less than 1. Next slide, please. And this is the most marked, or the most significant of all, wherein the deaths over time, as we look at this graph would show that the deaths are really decreasing from where we started, where there were peaks in the months of March and April. But until from starting May until this current time, the deaths are really decreasing, and even the mortality doubling time is up to 9 days already for the whole country. Next slide, please. So we go now to expanded testing. So I heard our representative from Batangas stating that it was really a confusion with the terms mass testing and expanded testing. So we never used really the term mass testing because we do not like to confuse our general public that it would be all of the whole population or total population of the country that we are going to test. So we instead used expanded testing, which means that we do not test all individuals, but would only test those who are at risk of COVID-19 infection. Next slide, please. Our goal is to conduct 1.5 million tests by July 31, 2020, and this is about 1.5% of the population, benchmarking from the other countries who also are targeting about 1 to 2% of their population to be tested. Next slide, please. So for our laboratory status, we already have 67 licensed laboratories. So of these 67 licensed laboratories, we have 50 in the Luzon area, we have 8 in the Visayas area, and we have 9 in the Mindanao area. We still have about 163 facilities which still are having their applications and licensing process. And we have about 80 of this 163 which are already in the stages 3 and 4 of the process for licensing. And hopefully by the end of July, we will be able to license a minimum of 50% of these 80 laboratories. Next slide, please. So just to give emphasis that we were able to license already 67 laboratories as of today. And last May, the whole month of May, we were able to license 30 laboratories. And for June, we already have 18 laboratories that we were able to license. So considering that we started off with just one laboratory at the start of our response, this was the Research Institute for Tropical Medicine. During that time, we only were producing about 300 tests per day, compared to now that we already have 67 laboratories. Next slide, please. So our testing capacity also has tremendously improved. As I've said, we were just producing 300 tests per day at the start of the response. Now we are averaging about 13,141 tests per day with this 7-day moving average. We were able to test already 631 tests that has been conducted among the population, and we have a positivity rate of 6.9% currently. Next slide, please. So these are the groups that we have included in our expanded testing protocol. These are 6 subgroups, subgroups A, B, C, D, and E, and F. And for the 4 subgroups, subgroups A, B, C, and D, these are the 4 initial groups that we have included at the outset when we started off with our expanded testing protocols. Subgroup A would be patients or healthcare workers with severe or critical symptoms, and of course with relevant exposure. Subgroup B would be our vulnerable population, which we consider elderlies, those individuals with pre-existing conditions like diabetes, hypertension, those with cancer, HIV, and the others. Also, our healthcare workers are part of this, and also our pregnant women. For subgroup C are those with mild symptoms and with exposure. For subgroup D are those without symptoms but with relevant exposure, and these are our close contacts. Of late or recently, we have added subgroup C and subgroup F, considering that we already have expanded our testing capacity, and we believe that our resources already can accommodate subgroup C and subgroup F. So subgroup E would be our frontliners indirectly involved in healthcare provisions, such as those doing contact tracing, doing work in the swabbing centers, those monitoring our patients in the communities, the barangay health emergency response teams, the Philippine National Police, Bureau of Fire Protection, and the other officials who are all working and helping government in this response for COVID. For subgroup F, we have already included the other vulnerable patients, such as those patients undergoing dialysis, undergoing chemotherapy, those pregnant women who are about to deliver can be tested already, those patients who are going to undergo high-risk critical procedures in the hospitals are also part of these other vulnerable patients. So these are the different subgroups that we deem should be prioritized because they are high risk and are part of our expanded testing protocols. Next slide, please. So our strategies to expand testing would, of course, include we like to maximize the capacity for existing licensed laboratories. So we have computed the rated capacities of each of these licensed laboratories that we have. And for now, we already have about 50,000 rated capacity among the 67 laboratories, meaning we have computed for the number of the RT-PCR machines, how many it can produce, the number of health human resources, if they have a complete set of health human resource personnel in their laboratories. And the third would be the operating hours that the licensed laboratory has submitted and has declared that they would be doing. So with all of these factors, we have computed it to have this rated capacity per licensed laboratory. So the rated capacity right now of all of the 67 laboratories is about more than 50,000 tests that can be done in a day. But of course, this is not considering the different issues in operations that is daily and is encountered daily by our laboratories. So our laboratories currently are experiencing operational issues for their day-to-day operations, like, for example, the shortage of supplies, where we all know that there is also this international shortage for these different laboratory supplies. Second would be unforeseen events, just like when there are typhoons that our laboratories are affected. And the third would be health human resources. We are trying to address all of these issues currently so that we can somehow stabilize the operation so that we can optimize the testing capacity of each of these laboratories. The second would be licensing more laboratories. And as I've said, for this past month, May, and then for this current month, we already have licensed a total of 48 additional laboratories to expand our testing capacity. The third would be establishing big testing laboratories. So we have right now big testing laboratories such as the Philippine Red Cross laboratories. We also have a big laboratory in Pampanga, the Jose Bilingad Laboratory, which commits to provide or to produce 3,000 tests per day. We also are now setting up pop-up laboratories or these modular laboratories that will be situated in strategic areas of the country. And I think right now we already have 7 that are set to be established in these areas that we are now discussing. And then the fourth would be the other testing approaches for continuing expansion. So we are now using the gene expert facilities. Currently, we have 17 gene expert facilities, and this is the other testing approach that we have embarked on. Also, we are looking at other means of testing and other mechanisms or strategies to test, like the pooled testing that we are now discussing with our laboratory experts. We have a laboratory experts panel, which provides us with recommendations on these technical issues and about the innovative technologies that we are now having for laboratories. So pooled testing is already being discussed so that we can it can form part of the expanded protocols of the department, as well as with the other technologies that are all in the market. Like, for example, like what Dr. Tran has mentioned a while ago, I think it was her or Dr. Gonzalez, the use of the saliva for as part of the specimens that we will collect. So this is currently being discussed with our laboratory experts panel. Next slide, please. So for rapid antibody testing, so we just like to again remind everybody, first, it is not to be used as a standalone test. So like many of those that are implementing or using rapid antibody tests, they do their confirmatory test with our RT-PCR test. But just to give a special focus that the rapid antibody test, if at all possible, should not be used as a screening procedure, so that for us to say that if a patient has COVID or the virus, or the patient doesn't have the virus, because it leads to false positive and false negative results. So we might be misdirected because of its use, so that we have to use it we have to use it appropriately, and we should be directed. Also, for this rapid antibody test, the test that has to be used should be validated by our ITM, and the test, the sensitivity should be more than 90% and specificity at 100%. So all of these rapid antibody test results that would confirm a positive result, like IgM positive or IgG positive, should be subjected to RT-PCR testing. And as I've said, it should be registered with FDA, and it should be validated by our ITM or DOST. Also, for return to work protocols, it has been provided for in the protocols of DOH and also by the Interagency Task Force that testing of all returning workers is not a requirement prior to his or her return to work. So with all of this, the DOH together with DTI, with DOLE, and the other agencies have enforced this protocol that IATF has provided. Next slide, please. So just for a last slide, this is part of our revised protocol or the updated interim guidelines on our COVID response, where we have included discharge and recovery criteria. We, in the recent weeks, there was this evidence that has been issued where it states there that a person who is COVID positive is no longer infectious by the 10th day of illness. And if the patient is already asymptomatic, therefore, you don't need to use test anymore or to test the patient. They can be discharged already, and they are considered as non-infectious. So with this evidences that has been issued, we are now shifting, and we have now shifted into this symptoms-based approach compared to our previous test-based approach in discharging and identifying patients or persons as recovered. So in our Department Memorandum 2020-0229, in our previous DM, we have stated that for those patients who are admitted in hospitals, they would still require a negative test from an RT-PCR or a positive IgG test for the rapid antibody test. And for those asymptomatic, if they remain to be asymptomatic and they have negative RT-PCR or positive IgG for the rapid antibody test. But now we have revised our guidelines to have it as a symptoms-based approach, wherein symptomatic patients who are currently admitted in hospitals or in quarantine facilities, once they are no longer symptomatic for at least 3 days, and with a clearance from their doctors, they can already be discharged, but they have to undergo another 14 days at home or in a step-down facility in the local government unit. Also, those who are asymptomatic or who does not have symptoms at all but are confirmed positive cases and remains to be asymptomatic and has completed at least 14 days of quarantine, they can already be discharged from the quarantine facility, and they do not need to undergo any tests at all. So just to emphasize again, the symptoms-based approach of discharging and tagging a patient as recovered do not need any test anymore for them to be identified as a recovered patient or for them to be discharged from a healthcare facility such as a quarantine facility or a hospital. So I think this is the last of my slide. Thank you very much for your attention.
Thank you so much, Undersecretary Vergere. Let me now go to, we have very few minutes because we're really outside of our schedule. There are 3 questions posted by our audience. First is by Dixon Yasay, and I'm addressing this to the local chief executives. LSIs and ROF seem to be constant across political jurisdiction. How are you handling them? What are your protocols? Would the protocol be upon arrival? or a lapse of a certain period of time? Mayor Trenas,
Yes, Lou,
yes, sir.
Iloilo City is concerned, originally we had an executive order which we already applied for several days. With parallel testing using the rapid test kits and the RT-PCR. Unfortunately, the rapid test kits resulted to a false negative. It resulted to some LSIs going around their barangay. One went playing basketball, one had a manicure and pedicure, another one went on a drinking spree, and using the Filipino term tagay, using only
one glass. Yeah.
I am amending the executive order today, which will clearly state, one, we are no longer going to use rapid test kits for this arrived W and LSIs. Second, we are only using RT-PCR. That the good U.S.A is here, if probably she can help out, make sure that the results will be out. Now we are waiting for about 8 to 10 days for the results to come out. If the waiting time can be reduced from 8 to 10 days to 3 to 5 days, then it will help us a lot. Furthermore, the protocol will also make sure that all the returning OFW and LSIs will have to go on strict quarantine, 14 days. For the OFW, up to now, OWA continues to take care of them, brings them to a hotel, and holds them in quarantine at the expense of OWA. So we have no problem with the returning OFWs. Insofar as the LSIs are concerned, they will have a choice of staying in the LGU facility or to a hotel of their own choice and at their own expense. However, I am going to station PNP personnel to make sure that the quarantine will be very strict. We have made this since we have seen that returning LSIs do not conform to the strict quarantine. As a matter of fact, we have made them sign undertaking immediately after they arrive here in our city. But unfortunately, let us all be, we have to understand that strict quarantine is very difficult for them. So it is either facilities quarantine, the one owned by the city, the one provided by a partner, FINMA UI, or they go to a hotel of their choice at their own expense.
Thank you, Mayor Trenas. Mayor Teodoro, are you here? Mayor Teodoro? Wala si Mayor Teodoro. Mayor Moreno.
Yeah, Manu. Actually, the problem now that is evolving and that is getting to be the most complicated, complex, and difficult is generally the arrivals, the ROFs, the LSI, and many more. No? And Cagayan de Oro, given its location, the gateway to Mindanao, and right in the center of the upper half of Mindanao, we we have more arrivals than probably many. And certainly very important that we ensure that the safety of not only of those who will arrive, but also those who are in the city already must be ensured, no, must be kept. However, I would like to mention though that over the last 2 weeks, I noticed, because we had been looking at positive cases and so on and so forth, no? I have noticed one important figure. Our LSIs constitute more than 60% of the COVID cases, no, in the region. And second, the LSI ROFs, there is no death. There are more recovered. Almost all of them are outpatient. So this data to me are very interesting. So because those in the city are worried about this LSI, and my God, so I have to explain it is their constitutional right, and also I have to explain that look at the figures. The positive cases may have increased, but look at what's happening. Most of them are asymptomatic. So most of them are in the CIU, and so it's just a matter of waiting for 14 days. Waiting for 14 days for the virus to disappear. But of course, the problem is how can we accommodate them? And I would always cite as an example, let's say we have 500 rooms available, because our CIU is generally one person to a room. And so let's say we have 500 rooms, and every day we have 100 arrivals. On the 5th day, all our rooms will be complete. And they're supposed to spend 14 days. So we have to look for ways to unload the CIUs with cases that that do not have to have the quarantine. So we're initially we're looking at RDT, rapid testing. Given our increased capacity for like I said, now we have 2 in the Region 10 and 2 RT-PCR and NUMC, and 1 each from Polymedic Hospitals and Xavier, and 4 more RT-PCR in NMMC. So hopefully by July, so we will have the capacity to do RT-PCR testing. The question lang is the timing. But we're lucky here because we have a good epidemiologist in the city. No? So sabi ko, lahat ng decision testing, whether COVID or RT-PCR or gene expert, with the clearance of Dr. Ituya. Probably narinig na yan ni Yusek Bergeri, no? But I think we're leveling up. Ang importante lang is siguro, and this is where the DOH can help. Yung mga airlines kasi, and there are at least PAL, Cebu Pacific, AirAsia, nalalaman namin yung arrivals only at the airport. Nalalaman namin who are from Cagayan, who are from Bukidnon, and so on and so forth. No? So we wrote a letter to the airlines asking them if they could give us, by interviewing on the check-in, for instance, the check-in period, bigyan lang nila kami ng advantage. These are the passengers from Cagayan de Oro, no? Para we can handle the reception in a more orderly manner. I think what we're heading here is given na ang vessels will dito sa Cagayan de Oro ang port, no? So I think the city will have to take a more active role in receiving and allocating even the regional arrivals, no? Dahil ngayon kasi magulo eh. We have region. We have a big basketball court used as a holding area for all arrivals in the region. And kami sa city, we have our own holding area, no? And we're streamlining the operations. Para ka na ring hotel, para ka na ring tourist provide or tourist services provider, and so on and so forth. Like I said, it's very challenging. And then ang ating medical personnel would be handling the monitoring of these people inside the CIU and even monitoring home quarantine. Thank you.
Check Bigere, would you want to respond to the request of Mayor Moreno? He was saying that there should probably be some assistance and hand-holding in order to assist the LSIs and the ROF, especially in Cagayan de Oro.
Yes, ma'am. Sir, we are now, we have issued new protocols for these locally stranded individuals, as well as for these returning OFW. So meron po tayong protocols that we follow. We work with this together with other national agencies. I will take note of this recommendation and request, and then we will be discussing this with the group, with the other agencies, para po we can address this kind of issues that are happening right now in our local governments. Over to you, ma'am.
Thank you, ma'am. To the Mayor Teodoro, are you here? Would you want to respond to that? LSIs and OFW, what is your protocol in Marikina? Would that be upon arrival or a lapse of a certain period? Where is Marikina in this?
Actually, since we're in NCR, we simply follow the protocol set forth by the IATF on this matter, and also with OWA. And I believe that upon arrival here in Metro Manila, they are being quarantined, and if necessary, they are being tested, and health certificates are being issued by the DOH on this matter before the OFW could actually go home to their families. The LGU basically is providing logistical support if needed, and if we need to validate some information on the ground, we are doing such action. We have a quarantine facility here in Marikina, but we opted to have OFWs quarantine in the assigned facilities in Metro Manila.
There's another question. Moving forward, your experiences need to be documented, case protocols established for future pandemic. To what extent have you partnered with local universities to build on shared experience so your city is future-proof? This is directed to the local chief executives. Have you partnered with the university so that your local university, so that there is case documentation and the learnings are shared, and future handling of pandemic can be a lot better? Sirs? Mayor,
yeah.
Yes, sir.
We have a partnership with Xavier University, and actually that partnership is very, very strong. No? And in fact, they have designed something, a program that would give us a better handle all the data that are gathered, no, by everybody, including the U.S. Army that I mentioned earlier. I guess what we need to do is to expand it to cover other issues as well. No? But for the time being, our daily press briefing actually also is the result of that is a compilation of all this data that we're able to gather since March 13. And my table now is full of all the materials for each of these daily press briefings.
Mayor, thank you, sir. Mayor Trenas? Wala na yata si
Yes.
Mayor.
Malu.
Yes, sir. Sir, yes.
For Iloilo, first we partnered with the Maritime University, the Iloilo John B. Lacson Maritime University, for the use of their training ship, which we use to house the frontliners of Iloilo City. Second, we partnered with the FINMA University of Iloilo for the use of their classrooms as a facility for the LSIs. And third, we partnered with University of the Philippines for the exit plan, which was prepared for Iloilo City. And we continue to have this relationship with these universities. They have been very helpful. They have been very supportive. And we thank them for all their support.
Thank you, sir. Mayor Teodoro?
Malu, we have a community college in Marikina. In terms of building the database of the COVID cases, they're helping us sa data analytics. Yung ganun. Yung results ng enhanced targeted testing namin, they handle the database basically. So yung partnership na yun, actually yun yung concentration or focus ng collaboration ng LGU and the community college.
Okay. There are still 3 questions, please, to Undersecretary Begere and our friend Dr. Tran from Vietnam. There is this observation that Vietnam is the way you communicate and the way you plan is very simplistic compared to what Undersecretary Begere presented. Is this a source of relief in terms of engaging the public, or is this a source of misinformation? Dr. Tran, before we have Undersecretary Begere? Are you still here, Dr. Tran?
Yes, I'm still here. And thank you for the question. As I mentioned and I presented in my slide, it's a very clear and very strong guidance from the government, from the highest level in the government, from our Prime Minister, and the engagement and the leadership of local authorities. So the whole public can just follow the instruction of the government. So and they engage and participate actively in the response plan of the government. So it's simple, but it's not simple because we in our society, in Vietnam society, we have a very strong sense of community. So we put the community in the first priority. People feeling that they need to have a responsibility to the public and to the community instead of their own their own interests. So, for example, I give an example. When all the overseas students coming home, they are asked to have a 14-day quarantine in centralized quarantine stay as a facility, and they all strictly follow that regulation. So there is no, denial or refusal or not compliant to the regulation. So very good the participation and engagement of community for the instruction and guidance from the authority. So I think it is also the reason for success in Vietnam.
Thank you, Undersecretary Begere.
Yes, ma'am. I don't quite understand the question, but when it comes to our numbers and the different strategies that the department together with the other national government agencies are implementing in this COVID response, we had always been transparent. We have different platforms for the general public to be informed with all of these things that we do. We have our daily pressers where we provide information on the cases per day. Second, we have different situational reports. We have the COVID tracker, we have data drop, and the others. So these things we have already shared with our institutions and other academic institutions, our partners from the National Task Force, the private sector. They are all working with us currently so that we can provide a better reporting system, and the numbers will be up to date as so that we can report properly to the public. So I think that's how I get it, the transparency issue. So we are now trying to improve our data through the partnership with the other institutions. Over to you, ma'am.
Thank you, ma'am. To the mayors, is it the best time to be local chief executives? Mayor Trenas.
This is my fourth term. When I was first termer mayor, I was just 44 years old. Now I'm 63. You're asking me whether this is the best time? Well,
yes, sir.
All the time is the best time.
Okay. Okay. No, you were prepared to face the enemy head on.
You know, my experience in local government, 9 years as city mayor before, another 9 years as a congressman, helped me prepare for this pandemic. Hopefully, it will not last very long. No? I'm 63 years old. I'm an insulin-dependent diabetic. I don't know if this is good for my diabetes, but hopefully this will not last very long because the strain will be felt by all of us, not only by myself, but for all of us, all my personnel in the city health, all my personnel. You know, I appointed Iloilo City as compliance officers. The only thing that they do every day is go around the city, make sure that everyone wear masks, everyone observes social distancing. They observe all the protocols that are required. It's going to strain personnel. Hopefully, it will not last very long. And hopefully, again, I would like to repeat, it's good that the U.S.A is here. I hope that she can do something about the capability of Western Visayas for testing insofar as our only laboratory is concerned. Have a waiting time of about 8 to 10 days right now. And this is not good. I hope that they can shorten the waiting time, no? Considering that there are nice spots, bright spots in the country today. Meaning to say that aside from the NCR and the city of Cebu, where we are looking at the epicenter of COVID-19, there are other bright spots in the support them by ensuring that their testing capacity are maintained and the results are out at the earliest possible time. Thank you very much.
Thank you, Mayor Teodoro.
Is this the best time to be a mayor, Malu? I think there can be no better time for a leader such as a mayor to work together with his people. This is a time that a community can be built to fight a common enemy, which is the coronavirus. So I think there could be no better time.
Thank you, sir. Mayor Moreno.
Yeah, Malu, you know, this is certainly very difficult very, very much. It's a trying time. But you know, one lesson that I have learned, you lead not to be popular, but you lead to make the correct decision.
Thank you, Mayor Moreno. Two last questions. There's a question from Gerardo Abenes. Is there a strategy to test underserved communities? I think they represent one of the biggest threats to containing the pandemic. Underserved communities. Any thoughts? Locally, nationally, ma'am.
Malu, yes. We are currently now trying to develop this protocol where we can do our zero prevalence test in our communities, identifying these areas really which are populated, and as you say right now, it's underserved. So hopefully with this zero prevalence test that we will do, we will be able to identify high-risk communities where people had been identified, no? That there are a lot, or the number of these positive patients are present in this community, so that we can provide appropriate intervention. So we are already going to start with the zero prevalence studies. Also, we are now looking at pool testing as part of this expanded protocol that we are now going to implement. So if this, our initial implementation will be with this communities in National Capital Region, which we have identified as having some issues when it comes to access to services, and also some issues with demographics. So over to you, ma'am.
Thank you, ma'am. Ma'am, another question. There's in all the discussions today, it seems that the delay in results is palpable. How do we mitigate this? What are the requirements? Physical, human, and financial resources, so that the problems at the local level can be attended. Kasi naghihintay ho sila ng resulta, and yet it echoes that surveillance, whether active, strict, strong, surveillance seems to be one of the strategies, but the delay in the results is very palpable. Where are we here?
Yes, Malu. We have already identified different bottlenecks in our laboratories. No? First, as I've said, the operational issues that had been hounding our laboratories for their day-to-day operations. And of course, the second would be our health human resources, which we know for a fact na there are a lot of those being affected, and also those people who are contractuals. No? So with this, we are now having these strategies, as I've shown a while ago. We need to expand their capacities, licensing more laboratories, like in Region 6, sir. We now have 2 additional RT-PCR, one RT-PCR and one gene expert laboratory that are set to be licensed. They are in stage 3 already. So if we can expand our laboratories also per area, then we will be able to spread out and distribute well the zones that are now being catered to by our specific laboratories. No? So kaya that's why there is this longer turnaround time, because in Western Visayas, we have just one Western Visayas Medical Center, which is our RT-PCR laboratory there. But if we expand it to more laboratories within a locality, hopefully the turnaround time would be lesser. Also, we would like to optimize the capacity of each of our laboratories. So there is this rated capacity, as I've said, but because of operational issues, we are not being able to optimize the capacity of our lab. So sana po matulungan din kami, no? The national government can be assisted by our local governments in directing also our laboratories, providing them with support so that they can optimize their capacities. Over to you, ma'am.
Thank you very much, Undersecretary. It's now 12:01, lunchtime. Let me just wrap up and say thank you. This is series for sessions that we've had on sharing what we've learned, what we've experienced, and moving forward. I'd like to thank Mayor Moreno, Mayor Di Macuja, represented by Dr. Barrion, Mayor Trenas, Mayor Teodoro, Professor Joaquin Gonzalez, our friend from Vietnam, Dr. Wang Tigian Tran, Dr. Ernesto Bontuyan, and the Undersecretary Begere. And I would leave you with this quote, today's disparities of health flow directly from yesterday's disparities of wealth and opportunity. Marami pong salamat sa inyo and taking time to share to us your learnings. We are wealthy because of this. Thank you so much. I will turn the microphone now to Diana.
Thank you, Malu. This is the last session of our leadership forum. Thank you very much for joining us today and also in the previous sessions. Stay safe. God bless.